significant amount of stress. These challenges are mainly related to academics, their clinical responsibility, financial strains, and apprehensions which are regarding the future prospects. Basically, the stresses are related to certain challenges, of which the most prominent are institutional based challenges, student based challenges, patient based, and faculty based challenges. The institutional based challenges are mostly confined to the infrastructure, the clinical resources, which is required for the training in a dental institute. Am I audible?
Yes, please.
Also, the institutional based challenges are limited to the amount of patients which are visiting the dental institute. The second is faculty based. Faculty based is mainly how much updated the faculty is about the new curriculum or along with the AI. Like now in today's world, AI is more into practice. So, how much they are updated about the AI technology, how much they know the curriculum, which is in the current trend, that they will be able to incorporate the same into their dental training. The next is student based. In the student based, it's mainly the clinical practice, the amount of patients that the student will come across, also the amount of stress that the student is going to have, that once he leaves the profession and he is a individual dental practitioner, so how is he going to that jump from a dental student to a dental professional? So that kind of a stress is also there in the student. Apart from this, a significant amount of stress is related to patient also. Like the student should have a good knowledge about the subject, or he should be having good amount of communication skill. Like if we are working in a non-Hindi speaking area, so the patient should be aware of talking in a local language also, which is much more understandable to the patient. So that will help in building a trust with the patient in order to know the past history or the current medical history that will help to provide a treatment planning, and this will affect the outcome. Then some amount of stress is related to the financial burdens, which are mainly the fees and the loans that the students would have taken, because medical and dental courses are very expensive. So the stress related to repaying the debts. So in order to do that, the students are in a hurry that they should pass the course as soon as they get in, and they should have a good clinical practice, or they should get a seat into post graduation, because of which they would be able to pay back the debts that they would have taken. Also, some certain education related stresses are there, or the challenges are there. Uh, like suppose there is not much amount of clinical training which is given, or not much amount of workshops or seminars being conducted. So the student will not be aware of all these things. His knowledge will not be upgraded. To certain extents, compulsory internships have been incorporated, and rural postings have been incorporated. Student exchange programs have been incorporated by the government, which are going to overcome or help the students overcome these stresses. Certain stresses are also related to the academic demands, which is mainly the high academic expectations that the students have, that they have to clear the exams, they have to clear all the assessments, there should not be any backlog. Clinical practice is mainly that since we are dealing with the patients, that the amount of error should be less, and the focus on the precision is so much that they take making errors as a mistake, and that leads to a lot of amount of stress and anxiety in their minds. Management is mainly related to the uh, student's own personal life, wherein that he's not able to relax, he's not able to engage in social gatherings, or not having enough amount of time to engage with his family, because the course is so wide and so demanding that the student starts to feel burnout and exhaustion. Financial strains I previously discussed, and there is certain amount of career ambiguity, which is mainly because of establishing a good clinical practice once he pass out, and also uh, having a postgraduate degree with him. So all these things, once he enters into the dental school, these all stresses start to bother the student. Now, the amount of impact these stresses have on a dental student. This could be in the form of the body, which is physiological impact. It could lead to breathlessness, it could lead to increased blood pressure, or there could be frequent infections, or generalized fatigue can be seen in a student. Also, psychologically, it can affect the student, wherein he will complain of depression, anxiety, difficulty in taking the decisions, or the student may feel overwhelmed most of the times, and also there will be a weakened immune system, loss of motivation will be there, a lot of brain fog will be there. So he will struggle to achieve good academic scores. His behavioral tendencies will change, more so between his peers, friends, and the family. They will say, the family can say that the student or the child has become more irritable or more aggressive or more distant, or he starts to cry on small things also. So basically the emotions are getting affected, he's not having the control on the emotions. Irritability is there, anger issues are there, crying on the small issues is there. And also these kind of students are more prone to accidents, they are more prone to have panic attacks also. So there needs to be a certain amount of prevention and management in dealing with these cases. Like the primary focus is primary prevention, which is providing a secure environment in the college or the work area wherein these kind of stresses are prevented, which is definitely not possible to a larger extent. So we'll go to the second stage wherein these kind of situations are addressed. Now, how do we address them? They can be addressed with the help of a faculty or with the help of a counselor, which now most of the colleges have started to incorporate within the institution. The student can talk to these counselors and they can talk about whatever stresses are bothering them and how to manage them. Now, this was a preventive part. Now, coming to the management, like how to manage or cope up with these stresses. What can be done is the very first and foremost thing is that this needs to be addressed. That, yeah, this is my priority. This is a set amount of goal that I have to do. So either a student can do it manually, that this something is a priority and this needs to be addressed at first. This can be done with the help of a digital calendar also. Like to-do list is something called as a digital app which can be downloaded, and it can help him or her to schedule a proper goal for the day. The second thing is they can practice deep breathing or yoga into their routine. Then, if they have a hobby, they can practice that hobby like swimming, running. Or if they don't have a hobby, they have to get one. They can do a journaling, write down the thoughts that are bothering them. So it declutters from their mind. Speaking to their friends or the family members who they trust is one of the measures that can be taken. Also, listening to music or taking certain breaks when they are studying, which is a Pomodoro technique. Like if a student is studying for 25 minutes, he can take a break of 5 minutes and then resume back to his studies. Also, there's something called as National Suicidal Lifeline Support, which is given. Uh, and they provide the services immediately and through the counselor online. They can be addressed, they can be used by the students, or at the last a professional health counselor can be approached, who can just help them with whatever anxiety or stress they are bothered with. I would like to conclude here that basically this is all a collaborative effort of a student, a teacher, and the institution as such, wherein who can help the student to come out or navigate through the challenges which are present in the dental institution, and also cope up with all these stresses with a dental professional or a student is going through. So, yeah, thank you so much.